If you are joining us for the first time, let me briefly tell you about us. Live Tampa Bay is formerly Project Opioid Tampa Bay, part of a statewide initiative funded by the Florida Blue Foundation and brought to the Tampa Bay region by the Tampa Bay Partnership. The goal is to mobilize business, faith, and nonprofit leaders in our region to join with traditional stakeholders to reduce overdose deaths in our community. We seek to accomplish this through a collection of different interlocking efforts, including advocacy, education, and collaboration between the business community, frontline professionals, and members of our community committed to saving lives from the opioid epidemic. And so this webinar series is part of that interlocking effort. Our focus for this webinar is the power of stories. You will hear how this theme fits into our strategic priorities from a panel of local and national organizations using stories to reduce stigma and build community. We'll have a brief break in the middle to hear from one of our community partners before resuming the rest of our panel discussion and closing with a prayer from one of our faith partners. Thank you all so much for joining us today. We want to start with a video from Shell Sparrowhawk, a person in recovery. She is the owner-operator of Sacred Spaces Recovery, a halfway house for people in recovery in St. Petersburg. And I'm going to go ahead and show this video that she shared with us.
My name is Shell Sparrowhawk. My sobriety date is February 22nd, 2022. You know, when I first started using, people I was around said, make sure you don't tell anybody. You know, society does not look at us. They're forever going to look at you differently. It's one of those things where I still feel like I have to look over my shoulder when I'm talking about anything to do with recovery, addiction, anything in public. It's something that I'm still having to like be comfortable with. I don't know. I think it's just, you know, it all comes from a misunderstanding about us and what we are. It's the fallacy that like we have like no moral character. Like it all depends on the fact that we must be just like bad people, and that couldn't be farther from the truth. Progress is not linear. It may appear as a family member or friend is doing great one minute and then later that day like just falling flat on their face. Life isn't linear. We have to circle back to a lot of the same lessons until we learn them. Don't give up on someone, you know, if they're having a bad day. We come back around. We have a lot we have to clean up, the wreckage of our past, and it's not easy. If we get rid of the stigmas and then just start seeing addicts and alcoholics as people that have often, you know, some mental health issues, or childhood trauma or PTSD or whatever, then the healing can begin. You know, someone has to feel like a person to just try, you know, start trying to treat themselves like a person. You know, recognizing that every life is worth saving. I don't care what you've done. From there, you know, we can get back into our families' lives, get back into our children's lives. It affects the whole community. I mean, it's just it's a family thing this whole country is going through, so it's going to affect every single aspect of the American way of life. And we are very resourceful, amazing people that can do a lot. So once we get back to feeling like people, back in our families, back in the community, we can start to give back and start helping communities that we used to only take from. Recovery looks like to me fellowship, community, helping others, giving back, finding your purpose, finding your passion, finding your authentic self. I am grateful for, first and foremost, the people in my life. I wouldn't be here without them, friends, family, AA community, you know, all of that. I'm grateful for art, for, you know, music. I am grateful for everything today. I'm grateful to be alive. The moment when you feel like giving up, don't give up.
Thank you so much. I don't know if Shell is on right now, but Shell, thank you so much for sharing just a small piece of your recovery journey and helping to build the community that we want to see. I got a chance to meet her at our luncheon at the end of March, and just felt a really strong kinship with her, and so really appreciate her sharing the challenges and the insights. This kind of gets into there's a few things that she said that really resonates because if you notice, I am hosting today's webinar. Jennifer Webb was going to provide some framing of Live Tampa Bay strategic priorities and how this webinar fits into our broader goals. Unfortunately, she couldn't join us today. She is actually attending the funeral for her cousin who relapsed and passed away after being in recovery for 18 months, which again, connects with what Shell was saying about how this is not a linear process, and that even talking about being in recovery, there's that stigma, there's that continuing struggle. Jennifer will give more insight into our strategic priorities next time, but what I'll briefly share is that this is exactly the reason why we're doing this webinar, why reducing stigma and building community is so important. How can we foster healing? As Shell was saying, when we collectively dismiss or disparage the challenges and the experiences of people seeking recovery. So our webinar today primarily ties into our strategic priority for education and life-saving interventions with a focus on creating those supportive communities through data-driven anti-stigma storytelling. We see anti-stigma storytelling as an essential component of life-saving interventions based on research showing that stigma is one of the largest and most persistent drivers of negative outcomes for people struggling with addiction. The impact of stigma can make people struggling with addiction more likely to hide illness or keep them from seeking treatment and support. It can be a barrier for receiving life-saving medications like Narcan in cases of overdose or medications for addiction treatment. And it can exclude individuals from the resources and the communities that support recovery and wellness. By highlighting stories of people impacted by substance use, we can reduce these stigmas and create more supportive communities for people to seek recovery. And toward that end, we want to dive into our panel discussion to hear from some incredible organizations and people doing this work. I would like to introduce Dr. Kristin Kosyluk as our moderator this afternoon. Dr. Kosyluk is assistant professor of mental health law and policy at University of South Florida, director of the Stigma Action Research Lab, STAR Lab, and faculty affiliate of the St. Louis de la Part Florida Mental Health Institute. Dr. Kosyluk received her PhD in psychology for rehabilitation counselor education from the Illinois Institute of Technology in 2014. Her research focuses on promoting recovery among people with mental illness with a specific emphasis on understanding and addressing stigma as a barrier to recovery. Dr. Kosyluk?
Thank you so much, Masa, for the introduction. Good afternoon, everyone. I'm Dr. Kristin Kosyluk, and I have the pleasure of introducing and talking to our panelists about their work highlighting stories to reduce stigma and build community. Our first panelist is Dr. Lilian Dunlap. Dr. Dunlap is the executive director of Your Real Stories, Inc., and co-creator, director of Decades of Day Work, Off the Wall, and St. Pete Stories series. Lilian is a former television news reporter, anchor, and producer, and former professor of journalism at the University of Missouri School of Journalism and resident faculty at the Poynter Institute for Media Studies. Lilian holds an undergraduate degree in music from Defiance College and a master's of music education in voice and a PhD in communication and culture from Indiana University. Go Hoosiers. She is the founding director of IU's African American Arts Institute, and she served as a senior consultant to the award-winning documentary Eyes on the Prize 2. Lilian arrived in St. Petersburg in 1999 to join the Poynter Institute Ethics Diversity faculty and began training professional journalists from all over the world. Lilian has since trained journalists in South Africa at the South African Broadcasting Corporation and in the UK at the University of Central Lancashire, and in Serbia in the Association of Independent Journalists. She has presented diversity seminars and workshops at more than 30 US universities, including consultancies at the University of South Florida in both Tampa and St. Petersburg. Our next panelist is Justin McPadden. Justin McPadden serves as the president and CEO of the Hope Shot, a person in long-term recovery. Justin is passionate about helping those who are still suffering from substance use disorder. Growing up in a family with substance use in the house, addiction was normalized, and he found himself stuck in active addiction for 23 years. Today, he's a married father of 5, a trained CCAR certified recovery coach, a contractor with the state of Florida, as well as a business owner in Pasco County. It is now his mission to help people in the county where he did the most damage. Through the Hope Shot, he hopes to assist people in transitioning back into society and find sustainability with recovery and employment. Justin aims to show people that we are only as strong as the community we serve. And finally, I'd like to introduce Asha Carroll. Asha Carroll is Director of Social Media Engagement for Shatterproof's National Stigma Initiative. In this role, Asha is responsible for creating, growing, and managing the paid and organic social media strategy of the National Stigma Initiative's statewide stigma reduction campaigns. Asha's chief interest is using modern storytelling to drive social change. She grew her career matchmaking consumer brands with fast-growing influencers in the early days of Instagram, and has created partnerships, marketing initiatives, and content for brands including Bob's Red Mill, Justin's Nut Butters, and Almond Breeze, and influencers including Food Network's Molly Ye and New York Times bestseller Tegan Gerard. She has worked 4 cycles as a political strategist and organizer, and is the founder of Phasey, a CPG startup with a mission of destigmatizing hormonal and reproductive health, distributed at national and regional retailers, including Urban Outfitters, Erewhon, and Foxtrot, and in publications including Harper's Bazaar and WWD, and on TV shows including Access Hollywood. Welcome to all our panelists. So before we get into specific outcomes and methods of your organizations, when it comes to telling stories, we want to start with a broader understanding of why stories matter. What needs in the community that you noted inspired you and your organization to start with storytelling at the center?
Okay, perfect. That was perfect. I could hear you. Everything was perfect. So what it took was we started because people can only dig up, they can only find the negative about most people. Most people don't see the success stories. Like what happens after the fact? Where do these people go? Even EMS, firefighters, police officers, everybody in the community only sees the negative. Well, where's the positive? Where's all the positive stuff that comes out of recovery? Like we need to share this stuff, and we're so used as a society of being anonymous. Like we have been bred into this anonymous role to where we, one thing, judgment, one thing, shame, one thing, guilt, like all this stuff. Like, but we need to get it out there and put it out there more and more and make a movement out of it to show that recovery works. And like people are succeeding at life after the fact of overdoses, after whatever it is, arrests, So in my case, somebody did dig up dirt on me. And so I wanted to show the positive impact, not in a negative light, but in a positive light, and show people that, listen, we do recover and this is what it is. And we're not going to feed into the negativity, and we're going to show you in a positive light what recovery is about. And to the people that might not never know that recovery is possible, like if that guy can do it, I know I can do it. And it gives them that much more. And then all of this pandemic and stuff like this, also a lack in recovery. People in recovery have lacked in their recovery. That's what happened to me as well. Meetings were shut down, all this stuff. So it's now we give them that inspiration, that spark again to start going forward in the right direction. So that's it.
Thank you so much, Justin. That's such a powerful answer. And there were like 2 huge pieces there. It was the story for the entire community that recovery is possible so that stigma dissipates, but then also the story for the person who might be currently struggling so that they know that this is a possibility for them. So powerful. Thank you so much.
You're welcome. Thank you.
We'll go back to you now, Dr. Dunlap, if you don't mind. So the question for you was, how do the stories that we tell ourselves, and each other impact our behaviors and how we treat each other.
Okay, great. We're back on track, right? This is so dear to me, and I'm so glad that the question happened this way so that I could hear your answer first to that second question, because you're right on the money. As a journalist, what I know is that when we describe stories, oftentimes we get, because of time and all kinds of other constraints, we might miss part of the story. And so we miss telling what is essential for people to hear. At Your Real Stories, what we believe is that the individual stories are not just nice to hear, they're actually essential because they're part of the community story. They're part of the state story. They're part of the world story. Each of us just has a piece of the story of humanity. And we're all the human beings on this incredible journey. So what we know at Your Real Stories is the more we can expose those pieces, the more that we can expose people, a wide variety of people to a wide variety of stories, we actually feed the community and contribute to telling the story of the community in a more accurate way. Because when we leave out people's experiences, then we diminish the truth of whatever it is that we're talking about. One of the things that, of course, comes to mind for me is how easily people can internalize, and just as you were saying, internalize the ways that other people describe and think of them. I'm thinking of as a young Black girl, thinking about a young Black girl, for example, whose only notion of who she is from media and from people outside of her writing about her, telling her that maybe she's not attractive or that she's got bad hair or something like that. People internalize that, and that, of course, affects their behavior. And, in the case of people who are pushing back against addiction, the ways that people with addiction show up in the press, for example, my goodness, why would you want to even talk to people who are having those kinds of issues, that are suffering with opioid disorders or substance abuse, that kind of thing. So it matters a great deal what stories are told, how the stories are told, who hears the stories. And one of the things that we work really hard at with Your Real Stories is we try to get a diverse audience whenever we are presenting stories or communicating the stories of people that we've interviewed. And the reason for that is we want a lot of people in the room so they can see themselves in those stories, because you can't help it. When you hear someone's personal story, when you hear their authentic voice being presented to you, and most often when we do presentations, we use professional actors to present the story. And the reason we do that is so we can get more of the story out. But we never tell the story of anyone without having the original storyteller sitting in the room, because it is still their story and still something that we hold very sacred. So we're convinced that storytelling is one of those tools for the community that we absolutely have to use. And I have a great interest in what, as professional journalists, what we do, how we describe people, how we get more information from people so that we don't misrepresent them. I've got to tell you that the other day when we were hearing the news of the shooting in Brooklyn, one of the disappointments for me was that the first descriptions of the person who did the shooting was that this was a Black man. Well, that's not a descriptor. It is incomplete at best. And I see that as something that happens across situations and groups. When we are, as journalists, lazy or inaccurate, we put out information that can be harmful to a lot of people. And we want to be better at that. So one of the things that I do when I travel around the world talking to journalists is to try to help them come up with an idea about how to interview people, how to listen to people, and how to get that authentic voice that Shell was talking about, and present that to people so that people are encountered in a much more humanistic and appropriate way. How's that?
So much. That was amazing. And that end message is so important, that we are treating people in a more humanistic and respectful way. That's the end goal. Most of the work that I've done with people living with serious mental illnesses, I hear all the time that it is the stigma, particularly the internalized stigma, that is sometimes worse than the symptoms of the illness themselves. Yes. So the work you're doing is incredibly important, both you and Justin. Thank you for that answer. So the next question is for you, Asha, if you don't mind. How can storytelling reduce the stigma associated with substance use disorder?
Thank you. There's a large body of evidence that demonstrates the power of storytelling. In research, telling stories is often referred to as contact-based education strategies, or messaging between those with a stigmatized condition and those without it. Lack of contact fosters discomfort, distrust, fear, and contact interventions aim to overcome that interpersonal divide and facilitate positive interaction and connection between groups. So in the case of substance use disorder, those impacted by SUD are sharing their stories with those who are less directly impacted by SUD. Storytelling, as pertaining to destigmatizing addiction, it serves to humanize the disease of addiction, increase empathy, and counteract the prevailing societal narrative that addiction is a choice or a moral failing. Research has shown that this approach has the potential to increase public support for policies benefiting people with substance use disorder. For example, in one study, relative to those who received only a magnitude of problem message, or a magnitude of problem and inoculation message, which raises and refutes potential future counter arguments, the narrative message reduced prescription opioid addiction stigma and increased attributions of responsibility to groups beyond the individual. So these contact-based education strategies are aimed at reducing public stigma on a person-to-person basis. But as my fellow panelists have said, they've also been shown to benefit self-stigma reduction by creating a sense of empowerment and boosting self-esteem for the individual. Shatterproof conducted an analysis of analogous anti-stigma movements to inform our stigma reduction campaign strategy, and storytelling proved to be an effective strategy for reducing stigma across several issue areas, not limited only to substance use disorder. And that is in that this storytelling as the strategy for reducing stigma is found to humanize the victim, so that the public could develop empathy. And that was found to be a critical part in movements ranging from HIV/AIDS stigma reduction to that of sexual violence. Frequently, contact-based interventions are combined with education where factual information is presented, and the people with lived experience support and personalize that information by relating it to their own life experiences. Results of a meta-analysis of 79 studies found that effect sizes for contact on attitude change and intended behaviors were twice those of education alone. And all messages increased public support, but combining factual information and the sympathetic narrative of that storytelling was most effective. For example, relating to our work, public support for naloxone distribution can be improved through education and sympathetic portrayals, those stories of the population who stands to benefit from these policies.
Thank you so much, Asha. That was a great answer. A lot of the work I've done has been in contact-based stigma change programs and storytelling. So I can attest to the fact that my research also shows those benefits for stigma reduction. So thank you so much for that piece. Masa, I'll turn it back over to you.
Thank you. Thank you so much, Dr. Kosyluk, for moderating the discussion. Thank you all for our panelists. Incredible insights. There's so much information, but then also passion and all of that again comes together. It's almost like an exact example of the information mixed together with the sympathetic, oh, this matters. This is real. So we're gonna revisit our panel discussion shortly. So I'm going to go ahead and stop spotlighting our folks for just a moment. But we're now going to have sort of a little commercial break. We know that no organization or individual can do this work independently. We're stronger because of our collaboration. So we want to highlight other organizations. If you would like to have your organization featured in our program in a 3-minute spotlight during our webinars, please let us know. We are happy to spotlight your work. Please just get in touch with us. You can put it in the chat or you can contact us after the fact. For our spotlight this afternoon, I would like to introduce Rob Reynolds, Director of Advocacy with doTERRA Verde Technologies, Inc. As doTERRA's Director of Advocacy, Rob works with organizations to help them understand the benefits of doTERRA and to assist in developing the most impactful implementation plans for their communities. Rob joined the doTERRA team in 2016 after retiring from a 31-year career in public safety, where he was doTERRA's first public safety customer. Rob, are you on the call?
I am. Can you hear me? Okay, it's a very short slideshow, and my hardest task this week is going to be keeping this within the 3 to 5 minutes. But I promise I will do my very, very best. I was really excited when I pulled this up and saw that the topic of today's meeting was storytelling. In my previous career, I had the opportunity to do a lot of speaking, and I would speak to anyone that was willing to listen to me on any topic, because I always said that I come to every presentation with a pocket full of variable stories with flexible endings, and I can change them around to fit almost any situation. So when I saw that was the topic today, I was actually very excited about it. Truly, I do believe that the best way of learning is to tell stories. I think we were all bombarded. I'm giving away my age, but I went to school in the 60s and 70s, and I was bombarded with, I'm sure, thousands and thousands of facts, of which I can remember none, but I can quote you all kinds of movie and musical lyrics from the 60s and 70s. So that shows that the power of storytelling is much stronger than just throwing some facts at you. So what I'll do is I'll talk quickly about doTERRA, because I think during the launch event about a month ago or a few weeks ago, we were able to distribute doTERRA to all the attendees, and I believe TJ Ward gave you a quick description. But I'll try to go really fast and tell you what doTERRA is, and then maybe speak a little bit to why doTERRA. So what doTERRA is it's a medication disposal pouch designed to be used at home or in the clinic, and basically it does two things. The first thing doTERRA does is it permanently deactivates medications so they're unavailable for abuse or diversion. The second thing it does is it makes it safe to throw away in your household trash so that you'll never have to worry about that pharmaceutical entering into the water system. And if you can just advance one slide, I'll tell you how it works. What you do is you just put your unused medications in the pouch. It works on pills, patches, liquids, creams, whatever you have. You fill it about halfway full of warm water, wait about 30 seconds, because when the water goes in, some air comes out, but then you just seal it up and throw it away in your household trash. And like I said, it permanently deactivates those, and it keeps them out of the water. So that brings us, yep, you can go to the next slide, thanks. That brings us to why doTERRA, and that's the more important part. They mentioned that this is a retirement position for me, and it is. The reason I chose to do this is we have a mission behind our product, And that mission is to change the paradigm of how people manage these medications that are oftentimes abused or diverted. So they're used in a way that they weren't originally intended. And we want to offer groups a tool that they can pair alongside of their education. So what we're trying to do is we're trying to change it so that in a generation from now, if you receive a pain medication for tooth extraction or some sort of orthopedic surgery or something like that, that you will both be educated about the medications that you're receiving, about their benefits and their dangers, and that you'll be, taught to, securely, to use them appropriately, to secure them while you're using them, and dispose of them properly. Because we know that medications that are sitting in people's homes do lead to substance use disorders. We know that people that are abusing opioids, over 80% of them get them out of the medicine cabinet of their friends and family. We know that children or young adults that are experimenting with opioids get them either after a tooth extraction or a sports injury, and they'll get those medications out of the medicine cabinets of their friends and families. So the prevention strategy behind this, of course, is limiting access. If we can get rid of some of these, we have data that shows that we can positively impact the instances of substance use disorder. But I heard in the introduction that there's also of the attendees today that there's a lot of business and faith community leadership in the meetings. And I'd just like to talk to you for just 1 second, because I'm sure you've been bombarded with a lot of facts about the opioid crisis. And really what we need is for you to start talking about this so that we can decrease the stigma, because the more we talk about it, the better we're going to be able to prevent it. And the people in recovery and in recovery programs know that the best, because this doesn't know, this opioid epidemic knows no boundaries. It knows, it's not no geographical, socioeconomic. There are no boundaries to this epidemic. And what I'm reminded of, especially with the faith community, they're talking about substance use disorder in a place where people feel safe, so that they're open to hearing the message. And a lot of them are offering prevention solutions like doTERRA, so that now they're educated. They know that they should get rid of these medications. So the next time I go to church, I'm going to pick up a pouch of that doTERRA and dispose of these medications in a proper way. Same thing with places of employment. We've done many programs with places of employment. And I'm talking specifically to business leaders here, because we've had programs that are successful and programs that are not successful. And the ones that were successful were the ones that were led by leadership of the organization. If you own a business and you as a leader get up and talk about substance use disorder, normalize it, because it is normal. It happens everywhere. It's happening to people in your places of employment. So if you can talk about that, because you talking about it gives all of your employees permission to talk about it. And it's if the leader of our group is talking about this, it's something that affects us. And as business leaders that, if your employee has instances of substance use disorder at home, they're not thinking about work. They're thinking about that. Thank you.
Thank you, Rob. I think that's a really great, I think a key message is, again, the fact that even if you yourself don't have a story to tell, the role that we can still play in our communities and in our roles to be able to make sure that we create safety for storytelling. And I think that's a great segue to come back to Dr. Kosyluk and the rest of our panel.
Great. Thanks, Masa, and thanks for sharing about that product, Rob. I had not heard of it before. I think it's really important. So thank you. I think it is important also to distinguish specific goals and outcomes when we're approaching stigma change. Since the effects of the methods that we use to go about telling stories can impact our goals and our outcomes. So the first question is for all three panelists, and it is, what is your organization's approach to storytelling? And what outcomes is your organization trying to achieve using this specific approach?
I'll go ahead.
Okay, thanks, Asha.
Thank you. At Shatterproof, our Unshame campaigns partner with local community organizations to tell the stories of people impacted by substance use disorder. So before the start of a stigma reduction campaign, we connect with local organizations working in the SUD field, building on the wealth of expertise that already exists within a region. Our work isn't about a few people doing a lot, but rather about many making small changes. So many organizations on the local level have been working to reduce addiction-related stigma in their communities for decades. So we're committed to creating meaningful and impactful partnerships and convening those already leading that work on the local level. Through our relationships with local organizations, we meet people who've been impacted by substance use disorder and want to share their stories. We then interview them, and we condense each interview into short form video content that we then share via social media channels throughout the duration of our campaigns. By sharing their stories, our communities come to understand that opioid use disorder is something that can affect any one of us, and that no one should struggle with it alone. So the stories shared are inclusive of a wide range of experiences, which I know folks have already mentioned. That's very important to us in the way that we approach our work. Different experiences and perspectives. So our campaign messaging can resonate with as many people as possible, and so that the general public can see that anyone can be affected by addiction. And like I said earlier, when these stories are coupled with educational interventions, they increase social awareness and attitude change. We find that social media campaigns in particular are an extremely data-driven, cost-effective way to reach many people, and they allow us to obtain the frequency and reach of messaging needed to achieve those attitude and behavior changes that reduce addiction stigma at the community level. And in addition to the general public, our social media campaigns also enable us to reach specific populations that may be identified as having increased stigma pertaining to specific addiction stigma related topics. So with this approach, we reduce addiction stigma by humanizing the experience of having a substance use disorder, educating that people on the fact that addiction is in fact a disease and not a moral failing. And by hearing the stories of people in recovery, the public learns that recovery is not just possible, but probable when we replace stigma with support, encouragement, and understanding. So these stories are stories of resilience, they're stories of hope, community, connection, and each story is a unique experience that chips away at the stigma surrounding addiction.
Mhm.
Thank you so much, Asha. It looks like maybe you want to follow up on that, Dr. Dunlap.
Yes, thank you for getting us off with starting us off with that. Yeah.
Sure thing.
The thing that we focused on at Your Real Stories is the idea that that the community is actually depriving itself by stigmatizing. It's because the values and the humanity and the contributions that people are able to make, we need them. We need them to be whole. So we're working to have people see that we're actually all just on this journey together as human beings, and some of us are having different challenges. But what we believe is if we can get people into a room, one of the things that we do is to create evenings of theater. If we can get people into the room to experience together the stories of real people, they see themselves in those stories. They hear something that resonates with them very strongly. And then they're more apt then to be listening to the rest of the story. I think one of the things that is so difficult about not hearing the whole stories of people or the stories of people is that we walk away with only the stigma, or we walk away with only that tiny piece. when there is so much more of that person to know and understand, and so much more that that person can contribute to us. So our mission for Your Real Stories is to create a space for people to experience the compelling, authentic stories of real people and to find the common thread that binds us together, because there are common threads there, and that's the opportunity to do that. So we've done this in a variety of ways. One, as I said, about we create evenings of theater where we actually hire professional actors, and we coach rather those actors very carefully, because there is another opportunity for us. People are going to the theaters all the time. People are seeing people portrayed in movies, and we want those actors to have that experience of telling a real story, of getting into someone's real life and being able to communicate that life. And every time we do this, though, for example, we might have a show that has where we talk about 4 or 5 different stories. For one thing, all of those people who have told us those stories are in the audience, because we're not going to share their story with anybody without their being present. And this is very important because it is their story. Reminds me also that when you were speaking about someone referred to this, many times when we go to the homes of people to interview them, sometimes for many, many hours, first of all, we want to interview people in their homes because they're comfortable there. But then as we present that evening of theater of their stories, for example, we will have several different stories, because that will bring several different cohorts of people to the theater. Then they are seamlessly exposed to stories they never thought they would run into. It's a totally new experience. And it offers a great opportunity then to spread the word more broadly, that this is our whole community. These are the people who make up the community. These are the experiences that grow the community. And then we give the community, everybody in the audience, the opportunity to participate in the conversation. And that's what we're after, that chance to create a safe space for people to ask whatever questions they have, to say whatever it is that they want to say, and then be able to interact on a very human level with people that they thought they were extremely different from, but they find out that they are not.
Thank you so much. Oh my goodness, that's so powerful. Mas, I'm going to ask for your guidance a bit here. I'm seeing time is might become an issue pretty soon. I would love if Justin would like to speak on this question. I think it would be wonderful to hear from him. And I don't know if you want me to skip the last 3, maybe.
Yeah, and maybe if Justin, if you could speak to incorporating some of the success points, because I know that there's a lot of overlap between the work that you're doing, both in terms of storytelling, but then also kind of that expanded work of RCOs and how all of this interrelates in kind of the work that you're doing.
Sure, no problem. Thank you both. You guys have some great insight into storytelling, and I appreciate you guys. So the hope shot. We believe the driving force in everyday life is hope. You know, to see somebody that is in recovery, see somebody come up on your Facebook and you're like, you're going through something, you know, and they're talking about the exact thing that you're going through. That gives people encouragement. It gives people that power that they need to get through anything in their lives. And the one thing about social media is a powerful tool if used right, right? And, you know, when it's storytelling, it's a double-edged sword, okay? We're reaching the people that are out there, you know, that we're telling the story to. But on the flip side, we have the people that maybe are uncomfortable. We are socially awkward creatures sometimes, and we need to be able to get through that. And every time we share a story, every time we go live, like it makes us feel like we're a part of something. It makes us feel like those chains don't hold us down anymore. The more we share it, the more we do it, the better off that we can break those cycles. And it gives us that confidence that we need to make us better people altogether. Our self-confidence was beaten down while we were in addiction. So we need to build those things up. It's a self-esteem builder. It builds rapport with people. There's so many things that it highlights. You know, so that's why I feel like it's one of the greatest things you can do while in recovery is share your story on a platform, in front of people, going back and reading comments of encouragement of, you know, people that might be going through something that needed to hear that. And then next thing you know, like, that is such a powerful thing to have a group of people together like that. Another thing is, I went this morning, actually. I went live on these groups. You know, I'm in a bunch of groups of businesses and all this. We're starting the RCO in Pasco County. And what it does, we're trying to tie community and we're trying to tie recovery together like a rubber band. We're going to bring them together, you know? Well, how do we do that? We got to break down the stigma. The more we talk about it, the more we're open about it, we recover out loud, the better it is for people to understand and to break it down. It's like chiseling at it little by little. They always say, how do you eat an elephant? One bite at a time. So that's what we're trying to do, is just eat one bite at a time and just keep doing it, and being transparent with all we do inside our organization, because the recovery community organization is one thing. It's about community. And what is community? It's everybody. It's not one sector. It's not recovery. It's not the politicians and this, that. It's everybody working together in every little instance of the community organization and tying it all together like a little bow, you know, and making a nice little present, you know. But storytelling is where we started. We do live on Facebook, YouTube, and LinkedIn. We go live every Sunday and Wednesday, 8 p.m. to share stories of success. And also we do topics, and we bring people in. We have a sign-up sheet to where anybody that wants to share their story, we want them. We want this to be about everybody, not just us. You know, because my ego can get really out of hand. So having other people involved and having them come in and let it be their show as well, it's super powerful, you know, that feeling a part. The opposite of addiction is connection, and that's what we're trying to do.
Amazing, Justin. And by bringing other folks in, you know, and not making it just about one person, it's providing a platform to, you know, help with healing. So amazing work that you're doing. I don't know if you've popped your information in the chat yet, but I'm sure that lots of people would like to connect with you if they haven't already.
I will try to get our Facebook on there. Right now we have about 22,000 followers on our page on Facebook. So, and it's steadily growing. So we will put that link in there.
Thank you. And with that, I'll turn it back over to you, Masa.
Thank you so much. And thank you all. Thank you, Dr. Kosyluk. Thank you, Dr. Dunlap, Asha, Justin. If you all can go ahead and put whatever contact information in the chat so that folks can follow up with you, any events, all of that would be fantastic, because I think, as you said, right, this is all about connection. And we want to make sure that, you know, part of the purpose of this is to be able to make sure that we have opportunities for connection and next steps of, yeah, how do we make sure that we share our stories and connect with people who are sharing their stories so that we can be part of that process, that community. We are going to make sure that we end on time. I would like to now introduce Pastor Sam Picard, who is going to be giving our closing invocation. Sam works on community partnerships and substance use for Baycare Behavioral Health. In addition to his work with Baycare, Sam is the pastor of Missio Dei Community in St. Petersburg, a small faith community serving homeless and precariously housed people. In that capacity, he also serves on the Pinellas County Homeless Continuum of Care Board and the Interdenominational Ministerial Alliance. Prior to coming to Baycare, Sam was a paramedic for more than a decade in Pinellas County, Rochester, New York, and Pennsylvania. Pastor Sam, if you are on.
I am. Thank you for the opportunity, and thanks for the great conversation. Please join me in prayer. Gracious and loving Creator, stories are a core part of how we interact with you and with the world you've created. Thank you for the gift of courage that we've heard today in sharing story, and the power that you give us each to influence our community. Give us strength, courage, and commitment to go out and share stories of recovery and hope, and work together for a better world for all people. Amen.
Amen. Thank you all so much. Thank you, Pastor Picard. Thank you, everybody, for joining us today. Penn is going to go ahead and post in the chat our survey. If you could fill out the survey, it'll take like 2 minutes, barely. It just gives us some insight, and it would be fantastic just to get, even if it's just like it was great, it was not great, just to have that feedback. If we can have, we wanted to make sure that we highlighted the different things that are coming up. So I want to just briefly allow Dr. Kosyluk to kind of share as the moderator, This Is My Brave, which is actually another storytelling event that is coming up. Dr. Kosyluk, could you give like a 30-second intro into this?
Yeah, so the 30 seconds would be, I was so excited to facilitate this panel because of the topic. This Is My Brave is a theater-based stigma reduction program, contact reduction program, where storytellers come to the stage and tell their stories of mental illness, addiction, recovery, and hope via creative expression. So monologue, poetry, song. We have 2 stand-up comedians. The show takes place this Friday evening at 7 p.m. in USF's concert hall. So anybody who would like to join us, please consider exploring that possibility. And I just do want to say accessibility is something we really want to try to support. So if ticket prices are a concern for anybody, the most important thing is to get people in these seats hearing these stories. So please reach out to me. I popped my email in the chat if I can assist with that in any way. Thanks for giving me the opportunity to say something, Melissa.
Thank you, Dr. Kosyluk. And another thing too that we wanted to highlight, we'll also include this in the follow-up as well. And Justin, Dr. Dunlap, Asha, if you have any other additional materials, please let me know so that I can share that with our follow-up email. But there's also SAFE. Is an organization that is hosting sober support events and sober seating sections with the Tampa Bay Lightning on April 23rd. They have an event coming up. There's a sober tailgate inside the arena prior to the game from 5:40 to 7. So feel free, look up SAFE, and again, to continue building community and sharing stories. And I think, Justin, that was I think a really great synopsis, which is the opposite of addiction is connection. And I think, we need more of those connections. So thank you all for connecting with us today and joining us. We hope you have a great rest of your afternoon.
Thanks, Masa.
Thank you. Thanks,
Thank
Masa.
you so much.
Thank you so much.
Take care, everybody.
Bye, everyone.
Bye-bye.